Hi everyone. And to begin our e-conference, I would like to invite Dr. Budi Sugiarto Wijaya as the host and the organizing committee.
It is my great pleasure and honor to be the host of 100th anniversary of Schroth Treatment e-conference. After a century, Schroth treatment has helped so many patients and gained acknowledgement as one of the best scoliosis conservative treatment method. Clinically and scientifically, Schroth best practice is a solution. So in this conference, we will learn about historical point of view and also updates of recent developments of the scoliosis conservative treatment.
Dr. Hans?
This is on.
I would like to give some information to the attendee first. May I?
Okay. Hello everybody. First of all, of course, I wish to thank my very dear friends from Indonesia, Budi and Regina, and their fabulous team. So these two ladies have dedicated their life to the treatment of spinal deformities. It all started in 1921 in a little institute my grandmother has founded, and here you can see her in the midst of her patients. She outlined her approach in a manuscript like this, and what she wanted to do is not bending, but shifting over the thoracic curves to the thoracic concave side and elongating to let the air flow. Here you can see some of these guys in action. And I can only say thank you guys.
Okay, so the first presentation, Japan. The title is In-Brace Correction Achieved with...
Hello everyone, and thank you very much for giving me the opportunity to...
The next abstract will be presented by Nan Xiaofeng.
Good day, ladies and gentlemen. The more severe it is, which curve is balanced?
So the next will be presented by Kong Xiaofeng from China. The title.
Yes, the previous surface EMG studies show that the muscle contraction on one side of the spine they have to relax, but when they exhale, they have to tense them.
Titled Effects of Exercise.
Effects of exercise.
The next paper, Rudolf Weiss again, from Germany.
So this one's on patient safety in brace treatment. Right thoracic turned into left, and here we still see the right thoracic curve in the brace arm. Another example. From Bad Sobernheim, when I was in charge in the clinic. From a prospective controlled study was 80%, and Alexander Kleban from Moscow University.
So we will continue with the last paper for this first scientific session. So the title of the presentation is The Effect of...
And it's great to see you all. Today I'm here to...
Effect of 6-hour dailies for SVP short-term 9 females have a beneficial...
We will begin our next session. It's the case report and practical issues. So the first paper is conservative treatment.
Back again. Thanks for your kind introduction. This is 70 degrees short best practice program, and already...
The second paper is from Turkey, Schroth Best Practice Program.
Thank you. Hello from Turkey, dear committee and participants. Do exercises. Thank you very much.
So the next paper from Japan. The title is Shorter.
Hello. Thank you for having me today. Instructed him SB to be classified. This This is an actual photo of the lumbar spine 14 degree.
Back to Chieko Ishihara.
The three-dimensional this is hard. Patient wearing cloth shows difficult. This side shows high improvement in you can see
from our dear friend, Dr. Yushi Swananda from Indonesia.
Hello, good evening, ladies and gentlemen. My name is Yushi Swananda, and I am a SBC Academy Board from Indonesia. Today, I would like to present a case report about Schroth. It is a standing on one leg balance pose as a balance standing in an extension. So as a background, adolescents should go to the left one. This is our axis. You can feel to get their balance or when they release their legs.
Okay, I will read a brief introduction for Maxim. Maxim is one of our good friends here in Indonesia because he has been visiting us for a few times.
Hello everyone.
Hello.
Morning, good afternoon, good evening for somebody maybe. Okay. In 1876, there was some photo in the end of 19 March on today because of side effects and some problems. Heartbreak. In 1972, we Boston brace in the middle. Nighttime brace. Here you can see. Let's have a look on soft braces. On today, spine floor is widely mapped. Next stage is big step forward, huge step forward. Another Schroth derived is from Dr. Rice. It's Schroth light brace. It's the most recent derived of Schroth style brace developed by grandson of Katharina Schroth. Also, it can be printed. First GBW brace have been printed in China in 2015. Result after winning. We start with 50 degrees and we see very good reduction of the rib arm. The moderate curve, embrace overcorrection, and end results, and rate of success is about 90%. This paper and approved adult patients we can improve posture and prevent low back pain. And for adult patients, the question from more information you can find in Schroth textbook of Scoliosis and other spinal deformities. So you can see different types of braces used with the recent approaches. And I would like to finish my lecture with these nice pictures with Kristalina Schroth and Hans-Rudolf Weiss with daughter and grandson of Katharina Schroth, which was taken in 2014. And with a small part of our great team. I miss you all, guys. Hope to see you soon personally. Thank you.
I am Atalia from SBP Indonesia.
I just need to share the screen here.
Yes.
So I'm sure all of you know what adolescent idiopathic scoliosis is. The actual shape of the vertebra itself changes. So another consideration is the height differences, menarche status. So that's an important consideration. Hair samples, I thought that may be a factor. Some other researchers still found virus-like parts. Okay, so environmental factors, there have been a number of theories.
Now, the first one, the abstract presented by Dr. Tong Seng from China.
Okay.
Which is the first study capable of doing so in China. 4 of the patients have combined curves brace treatment after scalatometry. According to these findings,
okay, thank you very much. So the second abstract.
Good afternoon, good evening. Already the positive light to the subject. When we look at our results in our study, we need in the previous study aspect.
The third presenter, Julian Wang from Taiwan.
I'm going to present according to the research of ZX, and because the pelvic dysfunction could be the cause of low back symptoms, so there are also another type of iliosacral dysfunction, which has in Krista's books. She described the doctor's contact flexion test. The fifth one is dynamic mobility test clinical presentations.
From Japan, the title is First and Results.
As you already know, insulin brace by Dr. Wise is the latest serum style brace. Here we have some pictures of the patient. A girl with 3CH or a girl with 4CL. These preliminary results encourage us.
Presentation by Alcin Dereli from Turkey. The title is
Regarding the therapy methods the participants use, mostly they mentioned Schroth therapy and 9 participants mentioned Schroth best practice, 51 participants mentioned bracing, and 41 mentioned use of chiropractic, and also many other types of treatment methods such as dry cupping, massage.
Now we can continue from Indonesia. Title is Impact of Dancing and Brace Treatment.
So according to AL Ascot classification, severe curve with top angle more than 40 degrees. So this is the sample of this is another picture of our patient's high correction specific bracing with fixing brace is effective in reducing structural joint.
Okay, now we already finished the second scientific session.
And now we will be continuing our session. The first paper would be from Turkey. The correlations of body image disturbance. Hi, yeah.
Patients complain about rib and scapular prominence. Body image has been seen as a conclusion. Perceptions on appearance.
The next one would be also from Turkey. Effect of Schroth exercises on postural studies of cardio presentation.
It has been shown that once already treatment in the first interview, all participants received information about. We conclude that Schroth exercise can be useful in contribute.
The next one would be also from Turkey. The cross-cultural adaptation, reliability, and validity.
It's considered that the main result, the aim of this study to assess the reliability and validity of the Turkish version of Scoliosis Japanese questionnaire identified adolescent idiopathic scoliosis with more than 10 degrees of curve angle.
The next one would be from Turkey again, the effect of symmetric mobilization exercises applied.
Previous studies reported hypokyphosis and hypolordosis in adolescents with scoliosis. And it should be possible to improve. Symmetric mobilization exercise was performed to set so. Here you see the symmetric mobilization exercise. If patient can reach her tooth or reach angle of trunk rotation was with increasing of spine flexibility and decreasing.
Thank you, Tuba, for the presentation. The last paper would be from China.
Share my screen. I want to share is Schroth best practice in terms of COVID-19. So last year from January to April. So that's what they have to prepare, very simple things. So this is patient, they have a laptop in front of them, and they have a mobile phone. Therapist also can see the patient back, so they can instruct the patient to move left and move right to show the correct exercises to the patient. And also, we can teach ADL. At first, after the 1-to-1, this girl is 3 months later, we see she's much better balanced. He has a more balanced body, and also the curve angle decreased. Finally, in Wuhan,
it's really interesting because we also provide online exercises at our center because of the COVID pandemic here in Japan. So the keynote lecture for Dr. Mark Marco is the chiropractor and SBT senior instructor.
Okay, thank you, Regina. And you're doing a fabulous job, by the way. Adolescent idiopathic scoliosis, also known as AIS. Goals of conservative treatment in 3D. First, we need to improve spinal function, vital capacity. So here's a chart, a graph, a formula. Early structural scoliosis is more amenable to conservative treatment. moving in the right direction. Physiologic exercises addressing the sagittal. We need to incorporate our program into the next part of our program, the third part, our scoliosis. Fourth part of our program, 3D Made Easy, simple 3D exercises until she reached full maturity. We will monitor her with scoliometry. Risen 2. This is an interesting case. This patient came to us and from the mom. She is 50 degrees and the thoracic spine 30. Today is my son's 30th birthday. Happy birthday, Matt.
Thank you so much for the presentation, Dr. Marco. So before we end our session, because this is the 100th anniversary of Schroth treatment, so we would like to have a little bit of festive here.
Okay, go ahead, Maxime.
I wish that this COVID time finish as soon as possible. We can meet personally, not online.
Yeah.
We can travel
Big amen to that.
Come to China, Maxim.
I'm still close. I can. I won't, but I can.
Yeah.
Wow.
Only no flight. Only if I walk, but it will take 2 months.
Yes, we wish that this COVID-19 pandemic will end soon. Probably I would want to say thank you so much to Dr. Hans for the dedication and hard work for all this time. I think you have spent most of your life dedicating in this scoliosis issues, scoliosis treatment, and that means a lot to all of us and all the scoliosis patients in the world. We wish you healthy and happy.
Also, Regina, thank you so much. But I must say you have done such a tremendous job. And
yes, excellent.
I can only say all the team, all the Indonesian team, so professional. And the good music was also in there. And I think my grandmother and my mother would have liked it.
So, Erdi, can you take another picture of us?
1, 2, 3, cheese. Once more, 1, 2, 3.
Okay, so thank you very much for
thank you everyone.
Everyone
it was
here.
an excellent conference.
Yes. So thank you to Dr. Hans, thank you to all the keynote speakers and all the participants, all the presenters, and of course thank you for my fellow organizing committee here for the hard work for making this happen. And to all the participants, we apologize if there is any inconveniences arises during the registration or the event. So again, thank you everyone. And stay healthy, and we wish to see you again in person. Thank you.
Thank you. Bye.
Bye, guys.
Bye. See you.
Bye.
We hope to meet in person.
Yes.